Can home sleep apnea testing give a false negative result? Have you ever wondered if a home sleep apnea test can sometimes miss the mark? It turns out that yes, home sleep apnea testing can produce false negative results. This means that the test might not detect sleep apnea even when it is actually present. Let's break down how this can happen. Home sleep apnea testing typically uses fewer sensors than in laboratory tests. It mainly monitors breathing patterns but does not track brain activity or sleep stages. This lack of comprehensive monitoring can lead to misdiagnoses. For example, if a person spends a lot of time awake during the test, the device may not pick up on the severity of their condition. This can result in an underestimation of the apnea-hypopnea index, which is a key measure for diagnosing sleep apnea. Studies show that the false negative rate for home sleep apnea testing can range from 3% to as high as 27%. The rate often depends on the severity of the sleep apnea and the technology used. False negatives are particularly common in individuals with mild to moderate obstructive sleep apnea or those with other health issues, such as atrial fibrillation. Another factor to consider is that home sleep apnea testing is done without the supervision of a sleep technician. This means that if there are issues with the sensors or if data is lost, there is no one there to fix it. This can further increase the chances of getting inaccurate results. Because of these limitations, medical guidelines suggest that if a home sleep apnea test comes back negative but there is still a strong suspicion of sleep apnea, further testing is necessary. This often means undergoing an in-laboratory polysomnography, which is considered the gold standard for diagnosing sleep apnea. This is especially important for those who have a high likelihood of having obstructive sleep apnea or who show symptoms that suggest a serious condition. In practical terms, home sleep apnea testing is most effective for confirming moderate to severe obstructive sleep apnea in individuals without other complicating health conditions. It is less reliable for ruling out sleep apnea, especially in those with additional health issues or when the test quality is not optimal. Some indicators, like the snore index, may help determine if a negative result is accurate, but these are not definitive. While home sleep apnea testing offers a convenient and cost-effective way to screen for sleep apnea, it does come with the risk of false negative results. Therefore, it is essential to interpret negative results cautiously, particularly in patients who continue to show symptoms or have risk factors for sleep apnea. Follow-up testing with full polysomnography remains the standard for confirming a diagnosis when home sleep apnea testing results are negative but suspicion remains high.